Hello. Today we are going to discuss the counseling process that is the crucial aspect of the healthcare. So what is counseling? Counseling is basically the process that helps in the decision making of the client. So healthcare counseling is particularly effective for decision making, education and the behavior change regarding the treatment plans, lifestyle changes and the preventive care. Counseling involves guidance through teaching and the understanding of the positive and the negative factors. So two things are very important while you are counseling the patient. The first thing is the power of listening, means without listening to others, do not respond. And the other thing is the power of absorption, which means how intelligent you are to answer with the logics. Let's discuss the gather approach, which is a patient centered and a structured communication model used in the counseling. Here is how to counsel a patient using gather approach, breaking it down step by step. The first step is greet. So greet with the patient warmly and create a rapport. The goal is to establish a respectful, private, and a comfortable environment. In greeting, say salam, use patient name, and make eye contact. The second step is ask. Ask how can I help you? The goal is to elicit the patient's understanding, feelings, and the priorities. You can start with the close ended questions and end with the open ended questions and listen actively in this step. And the third step is tell. Here you can guide the patient about different ways to resolve the problem. The goal is to provide the key information that is tailored to the patient needs and the literacy levels. So be concise and honest. The fourth step is help, means help the patient explore options and make a decision. In this step, you can instruct the patient on the positive and the negative aspect of the all pertinent and the alternative solutions. Here you can present options clearly, discuss benefits, potential risks, and what to expect. Elicit patient preferences, also support their autonomy in choosing the options. The fifth step is explain. So explain the process or procedure involved they have chosen. So give specific and the concrete information that is easy to understand. The last step is refer. Here in this step you can suggest follow up and refer to relevant expert opinion. Here you can schedule the next appointment. You can summarize the plan briefly and express support to the patient. So end on positive and a collaborative note. So that is the gather approach that you can use to move from simply giving information to facilitating the understanding and the empowerment, which leads to better adherence outcomes and the patient satisfaction. At the end, I have an activity for you people that how you counsel a patient who is newly diagnosed with type 2 diabetes on starting medication and the lifestyle changes. For further such interesting topics to understand, make sure to subscribe to our YouTube channel and place a comment about the topic you want to understand. We will make a lecture on that topic that will be easy and simple to grasp concepts. Thank you.